you want to talk about the breadth of different patients and the type of patients you see in this? I know you had practiced as a cardiac surgeon for about 40 years, so you'd see people who needed a heart transplant, or I know in one case we were seeing patients in Spokane, and a fellow said you had taken a bullet out of his heart about 10 years before that. So, but in this case, you're seeing patients that are different from the typical cardiac patient.
No question that to have your hand inside a chest around a beating heart is an extraordinary experience. And I think it was one of these experiences that kind of lit the fire, if you will, for me, and for the future of the use of something like cannabis. And I wonder if I could just say a few words, Paul, about one of the things that rises to the surface.
Please.
Especially when we see people in the clinics. We are seeing many, many people who are coming in with problems associated with pain. And this is a very important subject that needs to be discussed in the medical field as well as the cannabis field. People who become overusers of narcotics and opiates are frequently seen in our clinics, and it's in large part because of the inappropriate giving of narcotics to patients by physicians. And we see this constantly. And here we have this incredible medication, which can be used properly, can be very helpful in getting people off of the use of narcotics and opiates. And this is one area that we work diligently on.
Yeah, I've seen the vast majority of patients that come through with chronic pain issues who have been addicted by their physicians to these things, from OxyContin to morphine to many forms of synthetic narcotics. I would say about 80% of them completely get off of those narcotics by the time they come in for their renewal the next year.
That's cool.
That's accurate.
And maybe 10% have dramatically reduced it, and the other maybe 5%, 5 to 10% have continued it. But cannabis has been used by literally hundreds of thousands of people to help quit their addiction. In fact, you know, we show these medicinal bottles on our TV show all the time, and one of the things that it says on the bottles is it's for the habituates of opiates, chloroform, cocaine, alcoholics with delirium tremens, to help them get off all of those drugs. So it's been acknowledged as an aid in that for many, many years.
And even nicotine.
Yeah, nicotine.
We've got off of nicotine.
Frequently, you can attach yourself to something that moves you beyond the average. And I think being a part of medicine enabled me to do this. First of all, with the thing I loved so much was taking care of human hearts. And then when that time slided away, I could come in and continue to work with humans and their hearts, but in a different way, by advising them about how they can take care of their bodies, how they can avoid taking and eating the wrong things and the wrong medications. And I think I've been able to realize a second coming, if you will.